Good evening, everyone, and welcome to Pull Up with Limbs and Things. My name is Dr. Chanel James. I'm the owner of Limbs and Things, mobile and telehealth physical therapy practice. I serve aging adults in DC, in Maryland, and in Virginia. And tonight on Pull Up with Limbs and Things, we are talking sex and the aging adult with Dr. Ada Horsfall. And she is the Care Management Director at Life Matters. I met Dr. Ada at a networking event. We've been to so many, I don't remember which one. But I really do appreciate how she describes things. And she has done a couple of presentations on this topic that I thought was beneficial to share with all of you. So happy Physical Therapy Month. October is Physical Therapy Month. And how does this relate to physical therapy? That's what everybody wants to know, right? So a lot of times when we see patients post surgery, or even those that are in their home, they're wanting to know, is it safe for me to re-engage with sex? What position should I do it in? Are there positions that are safer for me, considering if I have an assisted device now, or if I am having pain? And then, so those are just some ways that we get involved in those discussions. A lot of people are not as forward in saying that to their physician. And because we are movement specialists, they tend to ask us. So tonight, Dr. Ada, welcome to Pull Up with Limbs and Things. How are you?
Fine, thank you, Dr. James. I appreciate you inviting me. It's a pleasure to be here today.
Awesome. So tell us a little bit about sex and the aging adult. What should we know?
Well, I think the first thing we should know is that we should remove bias when we're thinking about the old aging adults, because most people have this thinking that, because you're above 60, then, you're asexual. So I
Hmm.
think that's the first thing, is that, older adults, according to a national aging poll done by the University of Michigan, I think like 4 years ago, showed that they're still sexually active and they want to be. So I
Hmm.
think understanding that would also, like, you to the point you made with physicians not talking about it, when they after like post instructions for surgery, for
Yeah.
instance, it's not put in there. So I think it's because people have this bias of, you're older, you're asexual. So
Hmm.
I think that's the first thing I want your viewers to know today, that older adults, just like teenagers, are thinking about sex, they engage in sex, and we should kind of help support, them to have a healthy sexual life.
Hmm.
The second thing I would like your viewers to know is that, you know, apart like when an older adult, for instance, has surgery, there are other ways to maintain intimacy. It's not always about the actual act, but just that feeling of being connected to a significant other
Hmm.
can help with even the healing, can help with, reducing pain, because sometimes we're, concerned about like chronic pain with surgeries, and just the endorphins that are released, during the act of copulating, or just being emotionally attached to someone, can help
Hmm.
with even with the pain management as well. um, and then, okay, I also want to talk about another thing I would like your viewers to know is that physical therapy is indeed like one of the things that we recommend for some of the our clients, just because like different things, it could be arthritis, for
Hmm.
instance, that could have affected the knees, the larger joints. And so it's like you said, it's trying to help them find a different position that could help support, their sex life as well, even though they're dealing with different other chronic conditions. I also want to point out that sometimes some chronic health conditions, for instance, could also affect sex and intimacy. So it's good for primary care physicians and even family members to support their parents or loved ones when they're out having visits with the physician.
Hmm.
We know that diabetes can result like in erectile dysfunction. It can also result in women having multiple vaginal yeast infections, which could cause vaginal irritation and reduce the desire for sex as well. So maintaining blood sugars at appropriate levels, eating right, exercising can help. That way, those things are not as frequent as they've been. We also know that high blood pressure, or even following any cardiovascular incident, so people with heart disease, they're kind of consent to, but they don't want to bring it up because, if you've had a heart attack before, you're worried about engaging in sexual activity.
Hmm.
A stroke, because it could affect different parts of the body, is something that could also influence or affect how people think about sex. So I think the primary thing is we need to remove bias, and
Yes.
we need to encourage that. And I think for most times the adults are willing to talk about sex or what's going on. They just feel like they're going to embarrass their older child.
Hmm.
Or so I feel like if you understand that they want to talk about it, that they have those concerns, that they have the needs, then it will help with broaching the subject. So you know that they want to talk about it, you're free to talk about it, understand where they are, where they want to be, and then how we can support them.
Hmm.
The reason it's important to remove those biases is because of STDs. Because even though they are older adults, STDs is not like specific to just the younger generation per
Absolutely.
se. And in addition to that, most of them have been in a long-term relationship. Maybe a spouse has passed away, and
Hmm.
so they may be new to the dating scene, not really understanding how things are now. And so, being able to teach and encourage them about how to protect themselves, even while engaging in sexual activity, is something that is important as well.
Absolutely. So if you're watching us and you have any questions, if you're live, please hashtag live so we can see you. If not, we don't even know you're here.
Exactly.
So if you are watching this on the replay, hashtag replay as well. We definitely appreciate your feedback and want to get you answers to any questions or concerns that you may have. So if you put those in the comments, we'll talk about them as well. One thing I wanted you to talk about too
Mhm.
is how your cardiovascular system operates with sex in the aging adult. Because as we get
Mhm.
older, our vital signs change. And if you
Mhm.
can speak to that.
Okay, so yes, most like you said, the younger you are, the more active you are, and things that you would engage in, you wouldn't feel like breathless, like out of breath.
Mhm.
So as you get older, even just walking up the stairs can be a challenge, you know. And like I said initially, if someone has had a heart attack before or is on medication for any form of heart disease, it becomes a concern. And
Mhm.
so the first thing I would say is be comfortable speaking with your cardiologist. So instead of just going in for your visit, having, just listening to them say everything, and then you walk away still having those questions and trying to Google or talk to your friend, Mr. Smith, who had the same, condition like 2 years ago. I
Mhm.
would encourage every adult that, it's your prerogative to say, hey, I would like to ask you what you think regarding, based on the medications I'm taking, what your idea, what your thought process is.
Mhm.
And, and so, like I said as well, sometimes we have to kind of modify um, the way we view sex. It's not just on sexual intimacy. So if you've had a heart attack, I can't say, "Hey, you're free, go do whatever you want," because I don't want people coming back to say Dr. Horsfall said that. But what I'm trying to say is, in addition to the actual act,
Mhm.
there are other ways to satisfy each other. You know, and you can also just benefit from sexual intimacy. So you change your position. If maybe you don't want to exert yourself, maybe you should be on the bottom. So those are the kind of conversations. And I also know that there's sex therapists. It's
Mhm.
not something we talk about often as well, but I would also advise someone who has had a cardiovascular event to speak with their cardiologist and also maybe seek help with a sex therapist that can help, teach you and your significant other on other, like, different like modifications, or a physical therapist.
Right. Go to a physical therapist. That is
Yes,
the best
physical
person to talk to those things about.
exactly, or
Yeah.
physical therapist as well,
Mhm.
just to kind of help with understanding, positions,
Mhm.
and help with understanding signs to look out for, so that hey, maybe I'm overexerting myself at this time. Um, so
So tell us a little bit about your background because you have a little background in this topic that you didn't share.
yes. I've been in OBGYN for the past 5 years prior to moving to Life Matters as the director of care management.
Mm-hmm.
And what I realized looking back during my practice was the fact that even though we were in the business of like sexual and health reproduction,
Mm-hmm.
we weren't really paying attention to that when especially when it came to the older adults. And it wasn't because we're bad, doctors. It's just that when you're dealing with other situations that you feel are more serious, like so maybe someone who is having fertility issues, someone who has some ovarian growth, or something occurring in the uterus that you're thinking of a hysterectomy, somehow you kind of prioritize those as like serious issues because you can see it.
Right.
They're complaining of pain, or they're complaining of menorrhagia, excessive bleeding. And so when someone is really saying, and you're looking at them, is the bias as well. Even there's a study that showed that most times physicians didn't bring up those topics because they either felt like embarrassed because the client reminded them of a parent,
Uh-huh.
or they just felt some other doctor would do it, you know. So I feel like in retrospect, just like a few years before I left, we had someone else move into the practice that opened my eyes to really see the importance of addressing sexual health.
Mm-hmm.
Because at the end of the day, if you're feeling good in that regard, then somehow it even helps with every other issues you're experiencing as well. And
Absolutely.
so just understanding the fact that even though these are older, some we were dealing with older women, their sexual health was important, and talking to them about it and trying to help them with it. And so because of that, I have like an increased passion to kind of pay it forward, to say, hey, let's not be shy about talking about this. Let's reach out, let's provide support, let's help people thrive in their sexual and reproductive lives as well. And so that's it. That's why I've been having this talk. And I'm not making it as clinical because it's like just conversations we're having.
Mm-hmm.
Usually I would have a board and give you statistics and play some videos to kind of show you things, but just trying to say, let's talk about it, let's help support our family and friends.
Mm-hmm. I think that's sometimes the best way to approach it. A lot of people think you have to provide so many facts to someone, but if you get in a conversational tone with them, then you'll get more information from them that you probably wouldn't get when you're giving them more information.
Yeah, and I think sometimes just being direct, like asking
Exactly.
them, yeah, if because sometimes you can hear when someone is complaining about different things, and
Mm-hmm.
then you realize that maybe the root cause of this depression or this feeling, like they come, they say, I'm having pain. You check, nothing is really going on. Is to just ask that extra question. Are you lonely? How do you feel? Just so direct questions. How's your sex life? And they may be like, that's just all they've been waiting for, to kind of really, because like for real, like even as we are, how it is, when you feel like alone and not connected,
Absolutely.
because it's not just about the act itself, but the intimacy it brings, the feeling of being supported. It can help people sleep better. Sometimes someone is coming over and just complaining about not sleeping well.
Mm-hmm.
Maybe it's just to ask them, how is this going? It's also to set expectation. So, what you did in your 20s, 30s, 40s, 50s, you can't really expect to do that when you're in your 80s. But so setting expectation to just let them know, hey, you can modify what we're doing. You
Mm-hmm.
can you can do something different, and you can still gain enjoyment from it. Can help as well. So just helping set expectation, letting them know they're not alone. That you've come across this often can help as well.
I agree. Now you touched on some of the benefits. Are there any other benefits you want to discuss?
Oh yeah, I did. I talked about like sleep, right?
Yes.
And just feeling good. I
Uh-huh.
also, I think another benefit of like sexual health as well, can also be like just improve functioning, because like how they say the more you use something, the better it gets.
Yeah.
So like being able to, it just helps with like movement. Like PT would also say, use
Mm-hmm.
it or lose it. So I think that those are one of the benefits. It also helps with, you know, I talked about like preventing feelings of depression, suicide.
Mm-hmm.
It can help as well. And I'm trying to think what else can help. Yeah, okay, yeah. It can also help with like chronic pain.
Yes.
So yes, chronic pain, just those endorphins being released can help with chronic pain as well. Another point I want to touch on is like people with dementia or
Mm-hmm.
having and so we've experienced that sometimes um, they could be increased is two ways. It could either be an increased exhibition or wanting of sex,
Right. Mm-hmm.
or it could be a decrease. So it just depends. And sometimes the increase can also be associated with disinhibition. So they may be acting inappropriately outside, and it's just understanding that it's not really them, it's the disease,
Right.
and finding ways to distract them. So if you're prepared and you know that this is possible, maybe instead of going to a restaurant that is really well lit, you may decide to stay in the corner just to help. Like you're thinking ahead of time. And
Mm-hmm.
then also, like if they like music, maybe you have the favorite music, like classical or jazz or something on hand, something that you can use to distract them when they start exhibiting behavior that is inappropriate. Maybe having a flashcard that you can just like show to someone that just says has dementia, so they
Mm-hmm.
kind of understand the reason what for the behavior, and it's not like it doesn't get escalated.
Yeah.
um, can help as well. And sometimes they may call you the name of someone from maybe a past relationship. So
Right.
also teaching the partner or spouse to know that, don't take offense, don't correct them, don't say I'm not Jane, I'm Jan. Just go with the flow. Let it
Mm-hmm.
could just see it as like role playing, you know, that he's picking you up, like he's never met you before. So I think those pointers help because it can become really frustrating and very stressful for the other partner, when these things happen. And then if it's the opposite of it, like a decrease in sexual desire, maybe because they don't recognize who you are, and the other partner is interested as well, and still maintaining sexual relation, it's also help them see that it's going to be gradual.
Mm-hmm.
You may have to, if he says his name is John today or her name is, you may just have to just go with the flow basically. And then there are other ways to satisfy the feeling without necessarily getting everything you wanted it before. So like I said, it's always a mindset shift,
Yes.
just trying to help them see that you don't have to necessarily lose everything, but can we modify things?
Mm-hmm.
Yeah.
Absolutely. I think that's a good point. Are there any myths that we tend to have with aging adults that you might not have mentioned already?
Let me think. I think I said we always think aging adults are asexual, which isn't true. I think the other bias is that aging adults don't know anything about sex,
Mm-hmm.
which is really like really funny because if you look at it, we're all aging. And
Yes.
so someday it will be us on the other spectrum, and it
Mm-hmm.
will kind of be, kind of weird if our great grandkids or grandkids are saying grandma and grandpa don't know anything about sex. So I think that's one of the myths.
Mm-hmm.
Another myth is the fact that we think is inappropriate. I don't know if I would say it's a myth, but people just feel a certain kind of way if they see older adults showing affection in
Uh-huh.
public, you know. And it's always like ooh, or like I feel like the more we do that, the less we're helping the situation because we're making them feel more conscious.
Mm-hmm.
So that's one of the things I think. And I think another myth is the fact that we think older adults can get STDs. That's a myth because older adults can get STDs. In fact,
Yes.
studies, NIH studies have shown that recently, especially with the pandemic, that the numbers of increase in STDs, chlamydia,
Mm-hmm.
gonorrhea in older adults has increased, and also with congregate living as well. So that's a myth. Older adults can
Last
get.
part again.
Said again. I said
Yes.
especially in congregate living, like in
Okay.
facilities, like
Mm-hmm.
yeah.
That's what I
So
was just about to say. When I worked in a nursing home situation, there were so many people that were engaging.
yes,
Sometimes you would walk in on it. Sometimes you would just know that that was going on in that hallway.
yeah,
It was really interesting to see because a lot of people who would come through would just, feel a certain way, kind of like what you just described in terms of
Yeah,
the myths that we think is not happening,
exactly.
but it really is.
It really is.
Hmm.
Yeah. So I feel like understanding it's happening, understanding the fact that they can get STDs
Hmm.
is a really like important thing because we need to empower. If we don't think it's happening, then we won't empower, our, older folk to take care of themselves, to ask, to ask for safer sex practices.
Hmm.
Some of them are thinking it's the old days of chivalry where it was, one person to one, but because maybe they haven't dated in years,
Yes.
so they're thinking John is just my John, but he
Hmm.
might be like, so so I feel like I think those are the two major myths.
Yes.
Older adults are engaging,
Hmm.
older adults can get STDs. And
Yes.
so let's empower them to engage safer, in a safer manner.
So, what's a tip you would have for a provider who's wanting to open up the doors for communication
Mhm,
regarding this, but
mhm.
possibly is probably under the guise of being a little shy to address it?
I think the advice I would give is the one I would give for like just like I gave myself, for instance, talking to my teenage kids.
Mm-hmm.
I'm like, I would rather be safe than sorry, you know. And I feel like sometimes too, when an opening comes, depending if it's in the OBGYN clinic, I feel like that's the perfect spot
Mm-hmm.
because if someone is coming with repeated vaginal infections, maybe it's time to ask a question about, their sex life, like how many partners do you have, are you using a condom, are you, just asking those questions. But let's say it was just a random primary care doctor. I feel like understanding the need to support, understanding that if they're thriving in that area of their life, it would also improve their symptoms, can help you. So, if you're dealing with someone who is having chronic pain, maybe it's time to ask about that because it could help, with the pain they're having. If they're dealing with insomnia, maybe something is amiss somewhere. So you
Mm-hmm.
can, and I feel like just being genuine. So don't act like you're, don't laugh. I feel like just be
Absolutely. Yes.
genuine.
Mm-hmm.
Don't act like it's a big deal.
Mm-hmm.
So just say, hey, just for instance, Miss Horsfall, I just wanted to know how are you doing, in your sex life? How's that going? Do you have one? And you can say, I'm sorry if this makes you feel uncomfortable, but
Mm-hmm.
as your physician, I feel like if we can delve into this, I would see how we can be of support to you. And I feel like most people are comfortable, with a healthcare practitioner that is being genuine, that is
Mm-hmm.
saying, "Hey, I don't want to make you uncomfortable, but I feel like let's just get this out of the way."
I agree.
Mhm.
That's really good advice. The mature addressing goes over a lot better than laughing about it or trying to make light of the situation.
Yes, exactly,
Hmm.
exactly.
Another thing I would add in terms of physical therapy and sex, a lot of us tend to think that everything is horizontal, right?
Exactly.
And then with some people who are an aging adult, things are more vertical. And so
Yes.
you just want to make sure that you're balanced, that
Mm-hmm.
you have enough endurance,
Mm-hmm.
that you are making sure that you're at least against something that's not going to fall.
Oh,
You
exactly,
do not want
exactly.
to fall, especially during the act. And that has happened to some people I know. And so the fall situation when they're related to that are
Mm-hmm.
like one of my favorite shows on TV, Untold Stories of the ER.
Okay.
And those type of situations tend to be the ones that we end up seeing as physical therapists.
Therapist.
And
Yeah.
so we just want to make sure that you're doing safe practice, not just the whole sexual act, but safe movement practice as well.
Exactly. Exactly. And I think, how would you say you help with like stroke victims?
So for them, it's more balance as well, but then also in positioning and making sure that there's not rigidity that could
Mm-hmm. Mm-hmm.
possibly be triggered during the act. So
Yes. Yes.
it
You're right.
is utmost importance for that type of situation possibly to not be as vertical.
Mm-hmm. Mm-hmm. And I feel like most times it's also teaching and training
Mhm.
that we should, go slow. It's
Oh, yeah.
not how fast. It's not how, it's just enjoy the moment, create the
Mhm.
atmosphere. Don't have like overtly high expectations because you're aging, your
Right.
body's changing.
Mhm.
And another thing for women that can help, with aging is like vaginal lubrication.
Mm.
Being open to that. I know most people don't want to use like estrogens
Mhm.
just because of the fear of like breast cancer and all that. But they're really great, like lubricants, water-based lubricants, even some that have silicone,
Uh-huh.
that can help with lubrication, that can help with reducing pain during the act as well. So, like I said, be open, ask questions, and
Yeah.
don't feel like you're alone because you're not.
Right. And even though this subject might be taboo, because I see there are no comments today, we want you to feel confident to have these different conversations with not only your physician, but your physical therapist, whomever you're seeing that would be
Mhm.
more of the medical side or the movement side, because both go together with sex.
Yes. One of the slides I have that when I teach is something that shows a cartoon
Yes,
of
I love that one.
yes, of some older adults, and the man is saying, "Hey, let's just say Smith, Rose, just
Hmm.
calling her Rose, pole dancing ain't what it used to be." So truly, older adults, even now, I think they sometimes they're talking about things that you think they're
Yes.
not talking about, just like how we
Hmm.
have teenagers and they're asking questions. And so, and when we want to support them, we're being that adult that is having that difficult or weird conversation with that, with that teenager, because you want to give them the right facts, you want to support them to
Hmm.
make healthy choices. That's the same way. It's just like, things are reversed when you're older. So as if your daughter or son have a real conversation. If you're seeing that someone is seeing dad or mom more often than before,
Hmm.
hey dad, what's going on? Okay, are you protecting yourself? I know this may feel strange, but I just want to support you. And I think that once you have that initial conversation, it gets easier.
It
It's just
definitely,
that
it's
first
just that
icebreaker.
first one, right?
Yes, yes.
Yeah.
Once they see that you're not trying to control them or you're not
Hmm.
trying to tell them what to do, that you're really being genuine and concerned about their health, then you become that person they want to talk to.
I
And
totally
that's
agree.
exact. So just have that
Hmm.
first conversation.
Yes. So I know we didn't talk about Life Matters, but please share with us about Life Matters.
Okay, so Life Matters is a home private duty home care agency. We've been in business for over 17 years. We offer skilled nursing services. We also offer help with activities of daily living like bathing, dressing, light housekeeping. We work with physical therapists as well, to support clients in their home so they can, or in facilities wherever they are, so they can age and thrive well. We also have a care management piece, and that's what I oversee, the care management division. And we like to see ourselves as the quarterback of care for seniors. We're aging life care professionals, nurses, and social workers that can provide enhanced care coordination and healthcare advocacy. So, you go to your doctors, you age, you don't quite understand what's going on, or you have a lot going on and you just need someone that can be that voice, that person, that loud voice to say, "Hey, I need you to stop and I need you to listen to what I'm saying. I need
Mhm.
help with this," or to bring in resources to help clients to thrive and age in place safely. So that's what we do. And it's been a pleasure working with Life Matters, just supporting seniors. I think seniors are amazing, wealth of knowledge to learn from them if you would
Mhm.
only sit down and listen.
Yes,
There's just a lot to learn, and it's interesting.
I agree. I've heard so many stories about sexual health too through from my seniors as well.
Exactly, exactly.
They're willing to discuss it. It's not something that they're feeling is a uncomfortable conversation.
Yes, yeah.
Yeah. Well, I want to thank you so much for coming. Is there anything that you want to leave as a final thought for us?
I just want to say thank you for having me. This was,
Sure.
I think this is my first live event like this. So I appreciate being able to just share a little bit. I hope maybe in the future I can come share something else.
Sure.
I just want to say you're doing great work.
Oh,
I,
thank you.
I appreciate you, and thank you for your time.
Sure. Thank you so much for sharing about this topic that we all don't really like to talk about, but is very needed in discussing. So,
Yes.
as always, pull up with limbs and things is to confirm something you know, to challenge something you don't know, and to be able to share that information with someone else. Want to thank you so much, Dr. Ada Horsfall with Life Matters for joining us, and thank all of you for joining us as well. Again,
Thank
happy
you.
PT month. We'll
Yeah.
see you again next weekend. Take care.
Have a great week,
Bye.
and
You too.
goodbye.